Here's a detailed and comprehensive overview of Aztreonam. Number 1. Generic name, drug class, drug forms, brand name. Generic name Aztreonam, drug class, monobactam antibiotic, drug forms, intravenous IV injection, intramuscular IM injection, inhalation solution for nebulization, brand names Azactam IM injectable form, Cayston inhalation form used in cystic fibrosis. Number 2. Definition: Aztreonam is a monobactam beta-lactam antibiotic used for the treatment of infections caused by gram-negative aerobic bacteria, including Pseudomonas aeruginosa. It is particularly suitable for individuals with penicillin or cephalosporin allergies, as it has no cross-reactivity with these classes. Mechanism of action: Aztreonam inhibits bacterial cell wall synthesis by binding to penicillin binding protein 3, PBP3, of susceptible gram-negative bacteria. This binding prevents the formation of peptidoglycan crosslinks in the bacterial cell wall, leading to cell lysis and bacterial death. It is bactericidal and has low affinity for gram-positive anaerobic bacteria, resistant to many beta-lactamases produced by gram-negative bacteria. Number 4. Uses: Aztreonam is used to treat lower respiratory tract infections, e.g. pneumonia, bronchitis, urinary tract infections, complicated and uncomplicated, intra-abdominal infections, skin and soft tissue infections, septicemia, bloodstream infections, gynecologic infections, bone and joint infections, cystic fibrosis-associated pulmonary infections, inhaled Cayston form. Number 5. Indications. Aztreonam is indicated for treatment of infections caused by susceptible gram-negative aerobic bacteria, empiric therapy when multidrug-resistant gram-negative pathogens are suspected, inhaled formulation Cayston used to improve respiratory symptoms in cystic fibrosis patients colonized with Pseudomonas aeruginosa, safe for patients with beta-lactam allergies, except cephalosporins. Number 6. Contraindications. Aztreonam should not be used in patients with known hypersensitivity to Aztreonam or any component of the formulation. Caution in patients with history of allergic reactions to cephalosporins, as structural similarity may cause cross-reactivity. Number 7. Before taking this medicine, precautions. Tell your doctor if you have kidney disease or are on dialysis, have a history of allergic reactions to antibiotics, are pregnant or planning to become pregnant, are breastfeeding, Aztreonam may pass into breast milk, are taking other nephrotoxic medications, are using Aztreonam via inhalation Cayston, and have bronchospastic disease or asthma. 8. How to use. Injectable forms, IVIM, given by a healthcare provider in a hospital or clinic, may be administered intravenously over 20 to 60 minutes or as a bolus, intramuscularly into a large muscle mass. Inhalation form Cayston, administer using the Altera nebulizer system. Steps: 1. Reconstitute Aztreonam vial with diluent provided. 2. Place solution into the nebulizer handset. 3. Inhale the full dose via nebulization. Takes 2 to 3 minutes. 4. Rinse mouth afterward to reduce risk of oral thrush. 9. Dosing information. Injectable Azactam. Adults, 500 milligrams to 2 gram every 6 to 12 hours. Maximum daily dose, 8 gram day. Dose adjusted based on severity and renal function. Children, 30 to 50 milligram kilogram every 6 to 8 hours, max 8 gram day. Renal impairment. Dose adjustment required. Monitoring of renal function is essential. Inhaled Cayston. 75 milligrams 3 times daily, 8-hour intervals, for 28 days, followed by a 28-day off cycle, repeat cycles as prescribed by a physician. Number 10. Missed dose, overdose. Missed dose, take as soon as remembered. If it's almost time for the next dose, skip the missed dose. Do not double dose. Overdose, symptoms, nausea, vomiting, diarrhea, seizures, CNS effects. Management, supportive care, monitor renal function. Aztreonam is dialyzable, so hemodialysis may be used in severe cases. Number 11. When to stop or avoid taking. Development of severe hypersensitivity or anaphylaxis. Signs of Clostridium difficile-associated diarrhea. Onset of bronchospasm or respiratory distress, especially with inhalation form. Elevated liver enzymes or kidney dysfunction. Number 12. Side effects in detail. Common: local pain, redness, swelling at injection site, GI, nausea, vomiting, diarrhea, respiratory Cayston, cough, wheezing, sore throat, nasal congestion, fever, rash, headache, serious, hypersensitivity reactions, anaphylaxis, urticaria, angioedema, C. Difficile-associated diarrhea, hepatotoxicity, elevated ALT, jaundice, seizures, rare associated with overdose or renal impairment, bronchospasm, especially with inhalation form in asthma COPD patients, neutropenia, thrombocytopenia, blood disorders. Number 13, vital information. Narrow spectrum only covers gram-negative aerobes. No activity against gram-positive or anaerobic bacteria. Safe alternative in patients with penicillin allergy. Always adjust dose in renal dysfunction. Cayston inhalation should not be used for systemic infections. Number 14, other drugs that will affect Aztreonam. Drug interactions. Probenecid may increase Aztreonam plasma levels by inhibiting renal tubular secretion. Aminoglycosides increase nephrotoxic potential when used together. Loop diuretics, furosemide, may increase risk of nephrotoxicity. Other nephrotoxic agents, used with caution. No major cytochrome P450 interactions. Thank you. Have a nice day.